Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. Going to talk a little bit with Rick Lindquist. He's with a company called, I guess the company is actually called Zane Benefits. Is that correct, Rick?
That's correct, Kevin.
Yep. And you work with Paul Zane Pilzer. I guess he's the co-founder of your firm. And Paul Zane Pilzer is one of the most brilliant thinkers of the 20th century, in my opinion. Love his work. Been a huge fan of his work for really decades now, and delighted to be able to talk to you. I love the way he creatively looks at problem solving and really has this ability to think consequentially that I think is really why we are in a healthcare crisis today, is that there was a lot of decision making done for decades that wasn't consequential in this approach. Your thoughts about that?
Absolutely. In fact, we just co-authored a book called The End of Employer-Provided Health Insurance that discusses the major problem, and that is employer-paid health insurance. And the reality is health insurance is a consumer product, yet consumers in America have no say in most cases on what health insurance they get. Their employer instead picks it for them.
Yeah, no question about it. And so it creates this bizarre disconnect between the one who's paying for it and the one who makes decisions about it. And I really think probably one of the great turning points in the history of healthcare economics was the rise of the HMO. Had a devastating effect on that relationship, don't you think?
Yeah, so there's been a lot of attempts to fix the healthcare market. When in reality, we believe that at Zane Benefits that the first step is pretty simple. Put the consumer in charge of their own health insurance. So the model that we promote as a solution is we'll worry about the actual health insurance later. Let's give employees the money to go pick their own individual health insurance plan, independent of employment. And we believe that's step one. And then step two would be reforming the actual healthcare delivery once the money is in the consumer's hands.
Yeah, no question about it. Let's face it, different people have different needs. Some people don't mind paying higher premiums because they like to go to the doctor much more often. Well, there's a lot of people who are simply waiting for a safe to fall on top of them before they go to the doctor. And people should be allowed to buy insurance based on what they desire.
Absolutely. And one thing that the Affordable Care Act does, whether you like it or not, it does put some minimum standards in place that make it easier for a consumer not to make a mistake when buying health insurance. It's sort of like I like comparing it to buying a car. We aren't all mechanics and we don't all understand what goes into making a car work today, but we know when we go buy a new car in the U.S., it's going to get us from point A to point B. Whether we want a Ford or a Maserati is our choice, but we know that each one of those cars is going to meet minimum standards, and that's how the individual health insurance market works today.
Yep, no question about it. So step number one is to get individuals rather than companies buying it. And I guess that looks like employers simply giving each of them a certain amount of money each month, if that's how they want to benefit them. Kind of explain how that would look in the real world.
Well, it's very similar to the transition from pension plans to 401ks, where instead of the employer picking this one-size-does-not-fit-all health plan, they're instead giving employees the money to go pick their own individual plan. So here's how it works. Typically, the employer defines a monthly amount anywhere from $200 to $1,000 per employee per month, and then the employee goes out and buys their own health insurance plan just like their auto insurance. Then they get the reimbursement for whatever premium they're paying out of pocket added to their paycheck each month. So it's basically the opposite of what happens now where you have money taken out of your paycheck. Instead, money is added back in.
Makes perfect sense to me. A lot of common sense there. How do you see this working in the context of Obamacare?
Well, it's actually, I mentioned a few moments ago about the minimum standards, and what's interesting is, people used to be very scared about buying their own health insurance because oftentimes employer health insurance was simply better or more affordable. What Obamacare does, or the Affordable Care Act does, is it actually levels the playing field between the individual market and the employer market. And there's a giant kicker. On the individual market, there are these new premium tax credits that basically say that if you make, let's just say, an average of $100,000 or less for a family of four, you actually qualify for subsidies from the federal government that actually cap how much you can pay for individual health insurance. The government kicks in the rest.
Interesting. Yeah, I believe in free market approaches, and I would say, there is no role for the federal government in this, but it's really typical of entrepreneurs to rise to figure out how to make things like this at least better, even if the system itself is riddled with moral problems and such. It's an interesting conversation. I loved your book. I didn't agree with all of it, but then again, I don't agree with even stuff I write half the time. So, but it was an interesting work. How do we get more information about the book?
So the book is available from all major retailers. Amazon and Barnes & Noble are probably the easiest. You can also go to zanebenefits.com. That's ZANE benefits.com/book, and you can download a free preview.
There you go. Rick Lindquist, thanks so much for being with us.
Thanks for having me, Kevin.
When we come back, much more for you. Do you want to remind you, the best content here shows up over there at USDataReview.com, and you're listening to The Price of Business.